Hello, my name is Marina and I am a student of the Radiologic Technological Program at the Federal University of Technology, Paraná, Curitiba campus. This video, titled Scoliosis and its effects on the body, is presented for the Human Anatomy 1 course and the Estímulo Project, both taught by Professor Katia Elisa Bruspin.
Here are some topics I will cover throughout the presentation. What is scoliosis? Scoliosis is a condition in which the spine has an abnormal lateral curvature. It usually affects the thoracic and lumbar regions and can develop at any age, though it is most common in adolescence. The degree of curvature ranges from mild to severe, and symptoms may include shoulder asymmetry, uneven waist alignment, and in some cases, back pain. If left untreated, scoliosis can progress and lead to more serious complications. In this first image, we see an example of how the specific rotation and torsion angle of the spine is calculated. By obtaining these angles, we can determine the best treatment for each case. The image next to it shows an X-ray where the spinal deformation is clearly visible. What is the vertebral column? The vertebral column is the main support structure of the human body. In addition to enabling movement and providing stability, it protects the spinal cord, which transmits nerve signals between the brain and the rest of the body. Any alteration in the spine can compromise its function, leading to discomfort or even neurological problems, depending on the severity. The spine is composed of 33 vertebrae, including 23 intervertebral discs that act as shock absorbers, reducing the impact of movements. Additionally, ligaments and muscles help support the spine. When an abnormal curvature, such as scoliosis, is present, these structures can become overstrained, leading to pain and limitations. The spine is divided into 5 regions: cervical, thoracic, lumbar, sacral, and coccygeal. How does scoliosis affect the body? Scoliosis affects the body in multiple ways. In addition to the visible curvature, it can cause muscle pain due to postural imbalance. In more severe cases, it may compress internal organs, as shown in the adjacent figure, potentially impairing breathing and circulation. In the long term, if untreated, scoliosis may lead to complications such as herniated discs and premature wear of the spinal joints. Types of scoliosis. Scoliosis is classified based on its origin, meaning the cause of the abnormal spinal curvature. This classification is essential for diagnosis and determining the most appropriate treatment. The main types include idiopathic scoliosis. This is the most common type, accounting for about 80% of cases. The term idiopathic means that the cause is unknown. It is further classified by the age of onset. Infantile, 0 to 3 years, usually appears in early childhood and may improve spontaneously or worsen. Juvenile, 4 to 10 years, develops in childhood and has a higher risk of progression. Adolescent, 11 years and older. The most frequent type, especially in girls, typically diagnosed during the growth spurt.